In your feedback on Twitter, we are on KBC Channel 1 News. Mine is at Ray Manyara. We have at Jane Wamboy too. Remember, this is a conversation that we're having given the statistics, and we have a doctor here. We have a resident OB and gynae at the Kenyatta National Hospital, and this is none other than Arogo Rita taking us through this conversation, cervical cancer, detection and prevention. So we were talking about the secondary preventive measures, and we've talked about pap smear, and you were explaining why it's very important for those who are living with HIV needs to do their pap smears more often. Then we took a breather. Maybe we can start over from there.
Yeah, so like I was saying, when you're HIV positive, the risk of getting cervical cancer is high. It's actually 6 times more than if you're not HIV positive. So then we encourage them to do their pap smears frequently, actually annually, yes. It's easier for us then to pick any lesion earlier before it transforms into a cancer, yes. So that's why we encourage them, actually, if you're HIV positive, get a pap smear done. And then we tell you to do it annually, depending on the results of the initial one. Because if we get the results of the initial one not to be very good, then we might want you to do it after every 6 months, or we might take another intervention. But they're 6 times more likely to get cervical cancer than HIV negative.
On that note, there's someone who's asked, why are we giving the vaccine to the women and not the men?
It's because cervical cancer, majority of the people, the cervix first is in the woman. That's the baseline, yes. I'm not saying the men don't have the human papilloma virus, they do. But then this illness is rampant in the women. We encourage other modes of prevention in the other gender, in the male people, like male circumcision, condom use, yes, and also sexual education. Remember, you get the human papilloma virus from sexual intercourse. It's actually the most commonly transmitted virus. So then we don't say the men have no other preventive ways. It's just that cervical cancer is more rampant. This virus causes cervical cancer more, and the cervix is in the women. So we give this group a priority in terms of vaccination, yes, in terms of sorting them out, and then we advise the males to do things like male circumcision, yes, condom use, and delay also their sexual debut. Yeah.
So I hope Beatrice has heard that. They have just asked it directly, why are we vaccinating the women? And, in the issue of sexual reproduction and such. Well, thank you for that clarification, Dr. Now the issue, other issues, the HPV or other outward signs of HPV, other than the extremes of cervical cancer.
I would say it's very unfortunate or fortunate, depending on how you look at it, that in the initial stages of this disease, let's call it a disease. In the initial stages of this disease, it is asymptomatic, which means it doesn't show you symptoms. You don't see any signs in the initial stages. Remember, the vaccine is affecting the cells, yes, and the cells are very tiny things. So in the initial stages, you won't see anything. This transformation goes on for years, for a couple of years before you start seeing symptoms. And the most common symptoms when you start experiencing it will be what we call intermenstrual bleeding, like you might bleed in between your normal menses. So if your menses are usually like 28 days, 30 days, in between day 15, day 10, you're getting bleedings again. So that's intramenstrual bleeding. Other people also experience dyspareunia, which is pain when having sexual intercourse. So initially you were fine, you're having sexual intercourse, it was okay. Then all of a sudden there's a lot of pain, there's unbearable pain. Or you bleed after coitus. Yes, majority of the people present with bleeding after coitus because pain at times they bear and they don't want to tell their partner. But then the bleeding the partner also sees, and so it raises concerns on both of them and they come to hospital. So those are some of the most common symptoms: pain, bleeding. Yes, when it is advanced, you'll probably have things like back pain, hip pain, yes, lower back pain especially, and hip pain, yeah.
Stage 3, tertiary.
Tertiary prevention.
Yes.
Now this is the time where we initiate treatment. So we've made a diagnosis of cervical cancer, and we proceed to what we call staging. Now in staging, we determine how far it's gone, how invasive is it? So then based on the stage, then we offer different modalities of treatment. So in the early stages, surgery would cure it. We take it all out and we are done. And that's why we encourage people that we screen so that we pick it very early. So in the early stages, surgery sorts it out. It gets to a point you may need to require surgery plus radiotherapy to be able to sort it out or to put it under control. At times we require surgery plus radiotherapy plus chemotherapy. Yes. And it gets to a point where, which is probably the most common, stage 4, where at times you might have to just do palliative care. Because the reason why I'm saying it's more common in our country is of delayed diagnosis. Okay. People stay with the illness until it's very late. By the time they are coming, it's really advanced. It's spread to other places. Yes, so we move into palliative care. So then at that point, we are not saying, normally we don't use phrases like there's nothing we can do. Really, a patient has come to you. You have to do something.
That would be quite disheartening, especially
Precisely.
Hearing from your doctor, someone who you have put all your faith, your hope in.
Precisely.
Yeah.
So there's something that can be done at every stage, and that is why palliative care is also important. Yes.
Whew. God.
So the treatment modality needs to be really clear that it depends on the stage. It's not one treatment for all. Yeah.
Then how do you deal, you know, when you're doing palliative care, there's the issue of how comfortable mentally, you know, this person needs to be totally prepared for the event, in the event that the worst happens.
Yeah.
Do you also include that when you're doing this?
We do.
Yeah, because I lost a colleague last year.
Sorry.
And it took me, it just got me unaware because she was doing fine. Then on a morning, during a show, similar to this one, I receive a phone call. It changed everything. Because I remember the last time I saw her, we had a conversation, she was happy, she was surrounded with her children, by her children. Then all of a sudden, she went paralyzed, it was an emergency, she went to hospital, she came back after a week, very jovial. Then the following day, while seated here, she's gone.
I can imagine, that must have been heavy. Sorry about that.
Yeah, so that conversation, how do we prepare those who are already in this, rather who are still fighting this cancer or trying to get better? Do we prepare them mentally, you know, to just prepare for the worst? And also their caregivers, their family. How do we deal with that?
Yeah, so this is a more holistic approach, and especially palliative care. We try involve different aspects of this patient. The medical aspect of it, the nursing bit, the social, the cultural, the spiritual bit of it, and also the caregiver. One person people forget about is the caregiver.
Yeah.
They take a lot emotionally and physically. It drains you. So depending on the medical bit will handle it for you. The nursing bit will handle it for you. You can even have a home-based nurse to help you. But then the spiritual bit of it, we walk you through that. So we ask you, would you like a priest? Would you like your local pastor to be involved? Remember, it is all about your consent. If you don't give us consent to involve those people, you're the person who's sick. We won't involve them. You also tell us how far you want us to disclose when we are inviting these people into your management. You might want your local priest to just know you're very sick. You don't want them to know the diagnosis. So we let you inform us how far you want us to disclose this to everyone else that will be involving in your treatment. Yes. So we consider things like your culture, your social beliefs, the societal expectations that you feel, the pressure you feel. So we look at all aspects of you as a human being. You don't cease to be a human being, and all those things affect you. There are patients who tell you they don't want their children to know. The patients who tell you they just want the firstborn to know. Yes, and you need to respect that. You need to respect that. So we involve their caregivers. We offer counseling services to the caregivers, to the patients also. Because you see, majority of the time, either you'll go to a hospice or you'll be at home. Yes, so then you need to understand your illness. And we need to make you understand that we need to make you as comfortable as possible. You should never be in pain. Yes, so then there's a pain scale. We gradually get you, if this medication is not working for you, we either add something or change the dosage, but we shouldn't leave you in pain at all. Yeah.
That's quite reassuring. Now, the issue of stigma.
I know.
Yeah, from a doctor's point of view. Stigma and, you know, the fight against cancer.
Yeah. Another thing I forgot to mention is one of the symptoms is a foul-smelling discharge. And that is where the stigma comes. At times, you're not bleeding, but you're just having a foul-smelling discharge, which you don't understand. You're thinking, why am I having this vaginal discharge that is never going away? And that smell, to outsiders, that is where the stigma comes from mostly, because I won't come and tell you I have cervical cancer. But then they're like, this harufu, this smell, where is it coming from? Why are you constantly having a smell? And so the stigma starts with you. You don't want to go to places. You no longer want to go to church because of the smell. The society, once you tell them you have cervical cancer, it depends with the level of information also. We've come to realize that the more information people have, the less the stigma. It's just the same way when HIV started. The less information people had, the more the stigma.
Oh, yes.
Yes, no one wants to share a cup with you. No one wants to sit next to you. I mean, if I sit next to you right now, Regina, I'm not going to give you HIV. So it's the same concept. The more information you have about cervical cancer, we encourage people to read about cervical cancer, whatever you can get hold of. And this is not a disease that will be transmitted by contact. I will not sit next to you and give it to you. And people who have this disease require our support, both at the healthcare provider level and also in the community. They require our support. When it gets to a point where, I'd say like your friend, you get paralyzed, you need people around you. Yeah. You need people to support you. So we need to understand this is like any other disease, very preventable, can be cured, and if it's late stage and not cured, we can still manage it through palliation. So there's no point to put someone aside, to get them out of the trauma. Yes. In as much as the 5-year survival rate might be at around 85% if we pick it early enough, I think that's good enough. Yeah. I think it's way better than just declaring someone you're going to die. No one knows when someone else is going to die. There's no point getting them out of trauma. And these are experiences that I actually talk about when they come to the clinic. I was got out of the trauma when it got out that I have cervical cancer. I was sent out of my home. Marriages break because of this. People get co-wives, they get... Different things happen at the society level. And I'd just like to let everyone know that it's like any other disease. The way you'd get pneumonia. Would I kick you out of your house because you have pneumonia?
No.
Yes, I would support you through it until you recover, right? So I think it's the same kind of support that we need to offer these patients. Yes, if you can prevent it, fine. If you already have it, it's not the end, and no one should make you feel like you're less of a human being. You're still part of this human population, and we still need to treat you with the same respect and dignity that we accord any other person that doesn't have the disease. Yeah.
Now, okay, that conversation takes me way back, but now let's focus. Now, we were talking about the prevention of it, and we have gone through the 3 stages of it. I want to take you back to the prevention. You've told us, you've explained why we need to vaccinate our children, or rather young girls between the age of 9 to 14. I'm going now to the ones who are sexually active, the age of 24 to 69. For instance, a person X has taken this particular pap smear and it indicates that they have HPV. How then their relations with their partner, do you advise that they come in together going forward, or how do you handle that? How do you handle such a case?
Pap smear generally does not...
After the results, like
after the results,
has tested, breaking that information to her partner, you know, that conversation.
When the pap smear results come out, pap smear will tell you, because you see, pap smear is what we call cytology. It studies the cell. So it will tell you whether we are having changes in the cell that are likely to become cancerous, yes, or the cells are still normal. The cells are still normal, you live your normal life.
Now, if they're not, I'm talking
if
about
they are not
if
normal,
they are not.
If they're not normal, then depending on your symptomatology, Yes, depending on the kind of symptoms you're exhibiting. Because you see, at times we might want you to come in with your spouse, not because of the abnormal pap smear, maybe because of the discharge. Maybe it's breaking your home and we need to put a counselor on board with both of you. So at times when we request a patient to come with a partner, it's not necessarily so that we talk about the pap smear results per se. And by the time we are getting to the point where we are calling your partner, this pap smear result might have been very abnormal, which takes us to the next stage. You see, when we say your pap smear is not normal, we don't stop at that. That does not make a diagnosis of cervical cancer. We move to the next stage of now investigating you properly. Yes, we put a dye, we look at those cells well, we look at the cervix now itself as it is, like it's a whole stage. So having abnormal pap smear does not necessarily mean we're already having cancer of the cervix. Yes, and so when you have it and when you have abnormal pap smear, you need to see your gynae. Yes, so that we move to the next stage, so that we know what exactly are we dealing with. It does not mean your life changes. It does not mean you stop being sexually active, unless you're having symptomatology, like you're having pain when having sex, or you're bleeding, or the discharge is too much. Yes, or you need us to discuss this with your husband. Okay. Some people don't want to break the news themselves. So at times we request their partner to come. We talk to them. If you allow us to break the news on your behalf, because others say, hata nisikia, acha kuje next week. Yeah, so we let your spouse come just so we explain to them. It improves understanding and also acceptance of that news. Yeah.
Now, while we were having an earlier conversation, you told us about the HPV has been, several types, but the 16 and 18 is what causes cervical cancer. We have other types that cause other things. Now, issues of, the warts and everything, and I'm borrowing this from the issue of stigma, the issue of we do not have awareness as we should on ground. People see things in their bodies, but they are very reluctant to talk about it.
Yeah.
As a doctor, person in the medical fraternity, how do we get above these uncertainties and insecurities that a majority of us have? And they are working in retrogression as far as cancer and other diseases are concerned. How do we tackle that? Behavior change, confidence in our medical field, or rather the people we get in our hospital. Confidence. How do we regain that?
I'd say for majority of people, I think, first of all, one thing I usually say is if you have no confidence in your doctor, you're not going to get well. Because a good percentage is very psychological. The work we do is a very small percentage. It starts with the psychology of the person. So then, proper health-seeking behavior. My advice to my sisters usually is, during at night, when you're scrolling through your Instagram, your Facebook and everything, how about you read just one thing? Just one thing on health. You can read about COVID. Just read how does COVID show, or read something about health. So then that way you keep informed, and that information allows you to even have a conversation with your doctors. I encourage patients to actually sit down with their doctors and ask them questions. You see the way we're just talking like this? Yeah. That's how you should be with your doctor. Ask your doctor questions. I mean, I have anal warts. Should I be worried? That's what the kind of open conversation.
Should they be worried?
Yes, they should. We need to assess it. How bad is it? Or I have vaginal warts. It should be a very open conversation. And what I usually tell patients, don't ignore anything, however slight it is. Today you might be vomiting. When you come to the hospital and say, I'm vomiting, just ask your doctor, but how about this lesion I've been feeling here? Would you look at it? No sane doctor would say, no, you didn't pay consultation for that one. I'm not looking at that one. No. So once in a while, even if you just go to the hospital for a flu and you think there is something else that is private, and especially for women, I think because of the stigma, we tend to keep to ourselves a lot. We tend to be quiet about certain things so much. And I feel if you're just open about it, especially to your doctor, find someone you trust, find someone you have confidence in. Yes. Someone, if it's a nurse, if it's a doctor, find someone you have confidence in, whom you can tell, this thing doesn't look normal. Do you think I should be checked? Then they can accompany you to the doctor.
During my first pregnancy, I had a hard time visiting my gyna. Why? The person I got, it was the first time, so I didn't have a gyna. I got pregnant at a very young age, so I didn't have a gyna per se. So I just walked into a hospital because I know I have to do an antenatal profile, la 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 la.
Yeah.
So I walked in, did the consultation, walked to the consultation room, and pop, there is a gyna, and I had nothing to say. I'll never forget that experience. I had nothing to say.
You went completely quiet.
And he asked me, and I'm like, nothing, no sound, nothing. I just went like mute.
I know.
But I appreciate that he went out of his way. It was quite an old man. So I was seeing my grandfather and I'm like, what am I? This can't work, you know? This can't work. And he went out of he took his time to actually get me into, you know, the conversation and such.
Yeah.
And I appreciate that. I think we need to have a conversation where the doctor does not appear as an aggressive person, someone who is out there to shame you. I think there's that in society that if I tell Rita what I'm going through, Rita will be at the canteen there having a conversation about me.
Oh, yeah.
You know, there's that perception that this is still someone. They're still going to share that information with someone else. Now, before we take a short break, or as we take a short break, Daktari, I want you to, you know, take a breather so that we can sample some of the views that you have sent in. Just to remind you, just in case you had something to ask our doctor this morning, we're talking about cervical cancer. We have gone through the 3 stages. We're going to be taking a short break, but during this time, you can get us on Twitter. That is at KBC Channel 1 News. Mine is at Ray Manyara, and we have at Jane Wamboy. What is that question that, you know, you have been wanting to ask, but you didn't know how to put it across? This is the opportunity. Take a short break.